Hi, my name's
Hello.
Melanie.
Thanks for coming in today.
Thanks for taking the time to meet with me
No problem.
about this position.
All right, so we're going to start off. Tell me a little bit about yourself.
Okay, well, I'm a recent graduate of Ithaca College's physical therapy program, and I just got my doctorate in physical therapy. And so I've had, during my clinical grand rounds, which are when we go to different sites and do our services, I've done both, have experience with outpatient and inpatient services. So I've also volunteered at outside of those clinicals. I've also volunteered at a sports PT clinic and a nursing home. I've worked as a camp counselor for 2 years at Camp Yomi, which is a camp for 6 to 10-year-olds, and I've also worked at a camp, the Vision Center on Blindness, which is a overnight camp for both adults and children who are blind or visually impaired, as well as their families. I've organized in high school. I organized a volunteer group to volunteer at a public library at an elementary school. And I also have 2 younger cousins who I've been babysitting since they were in their diapers. And now they're 13 and 15 years old. And at college, I was the vice president of internal affairs for the Asian American Alliance for 2 years.
Wow, been busy. All right, so continuing with talking about yourself, what are some of your strengths and weaknesses?
I would say some of my strengths would be, in particular to this job for the Children's Rehab Hospital at the Mary Free Bed. I would say that my strengths would be that I really love kids. Like, as I've said before, I worked at 2 summer camps before, and I help take care of my younger cousins, and I've just, like, all my life I really love working with younger children and people younger than me, and I love, like, the energy that they have, and I think that, so I'm also, like, because I love working with kids so much, I feel like you have to be very creative and playful to keep kids engaged. So I feel like those are something that I've had practice with a lot. And another one of my strengths I would say is patience, because pretty much all of my volunteer work and my jobs have dealt with customer service. And especially when you're working with the elderly, when you're working with children and children with disabilities such as being visually impaired, but they also have other, like, developmental disabilities such as autism and ADHD. You gain a lot of patience, and I think that's something very important when dealing with kids.
Mm-hmm.
As for a weakness, I would say that since I'm a recent graduate of Ithaca College, I haven't had that many experiences in working with PT, especially with pediatric PT. And I've been talking with a lot of therapists, and they say that pediatric PT, I know, is very different from PT when, like, outpatient, when you're working with, like, adults. But I feel like that's, I'm really enjoy working with children, and I feel that this is something that there might be things that I don't understand initially when I start the job, but I feel like as it goes on, I'm a very quick learner, and I would pick up very quickly.
So why does this job in particular really interest you?
Yeah. The reason why I like I love working with children, if I haven't said that enough. Yeah. But ever since I started PT, I've always been interested in becoming a pediatric physical therapy or working in a pediatric PT clinic. And it appeals to me because I feel like pediatric PT, it's more emphasis. You have to incorporate play time with exercise, and that's not something you do in outpatient or most PT. Like, when you work with adults, you mostly just give them a set of exercises and they go do it. Mm-hmm. But with children, you can't just tell them to do something and expect them to actually do it. Like, you have to. It involves a lot of, like, creativity and a lot of thinking outside the box to come up with ways to keep the kids engaged. And it's a lot more work in that sense, where it's more than just coming up with an exercise program. You also have to you have to think about what they like, and every patient is very different from one another. But I really, even though it probably is more work, I like that creative aspect, and I think that would be fun. And also, like with kids, you have to be very high energy. You have to be ready for the unexpected, and I really like, you have to channel your inner child, as I would think of it, and I think that's something it's a lot of work, but it's also a lot of fun. So
yes, indeed. So why are you interested in working for this company organization?
Yeah. What really interests me about Mary Free Bed's pediatric division is that it's their inpatient rehab hospital. Their doctors, their nurses, and their therapists, they all exclusively work with children. And that's something that's not very common, especially in the physical therapy area. And I think that's something that's really cool because you're working with children pretty much all of the time, and that I think that consistency really works, especially and as a hospital, since pretty much all of the health specialists who work with the children, they're all in the same area. We're all within the same facility, so I feel like communication is also a lot better because you don't have to. You can, like, if you're waiting for like instructions from a doctor or another like speech therapist or OT, you can go to them like physically and ask for it rather than having to wait for days.
Yes.
For a patient. And I also like that you guys have a wide ranges of services available for the patients at your hospital. Like some of the things that you have a therapy pool for aquatic physical therapy, you do home evaluations, you do orthotics and prosthetics for the children, and the list goes on. I think that's just amazing how many services you have for kids, because I feel like the more services you have, the better quality you can give the kids because they have more access.
Yes, that is what we strive for here. Do you have any experiences that you've had in the past that you think have prepared you for this job?
I feel like I've had a lot of experiences with growing up, like being involved with children, working with them. But I feel like for this experience, I think my past experience as a camp counselor helped out a lot, because not only have I worked with children, but I've worked with children with multiple disabilities, and especially when it comes to like inpatients, like a lot of kids, like they don't just have a physical disability, but they can have multiple physical disabilities, but they can also have mental disabilities. And I feel like as a pediatric physical therapist, it's very important that you're able to deal with children from all different kinds of situations and all different kinds of issues, and
All right, so looking forward, where do you see yourself in 3 to 5 years?
In 3 to 5 years, I see myself, I like to keep consistent, like, I see myself expanding on continual education, like, yes, I just did 6 years of college, but I mean, especially, like, when you're involved in, like, the health fields, like, you never really stop learning, like, there's always new things to learn, like, for example, when I was in Ithaca College, I did a course on aquatic physical therapy where I worked with patients in the pool doing therapy, and that's something I'm really interested in getting certified as. And I'm also interested in doing like more like unconventional like health areas, like things such as like acupressure or meditation. Like I feel like those are things that haven't been researched as much, especially applied to children. So I think those are areas that I'd be interested in exploring.
All right. Do you have any questions for me?
Yeah. So I know that, as I was saying before, I think it's great that Mary Free Bed has so many different like areas within their pediatric. Like they have PT, they have OT, they have speech, they have people who work with prosthetics. And I was just wondering, how do they communicate with each other, or like how often do they talk to each other?
Like you said, we're all pretty much in a condensed area within the hospital, so it's pretty easy to just kind of go up and be like, hey, I have a question, or try and communicate the best you can in a fashion that's not necessarily as formal as like emailing a doctor or calling a doctor and having to leave messages and so on. So I would say communication's pretty frequent and pretty easy to go with. Any other questions?
Yeah. I just have one more. So I know that I was reading on your website that like the way the day, like they have like examples of like how the daily schedule is for children, and so I was just wondering like how often do the I know that physical therapists and other therapists, they see the children on a daily basis, but I was just wondering like how long do physical therapists usually spend time with the patients? Is it the same every day or is it different?
I would say it depends on the case that you're working with and the day as it comes. So if you go in to see a patient and they're not feeling well, like the circumstances can limit your time that you have or their ability to or want to cooperate with you. So I would say it fluctuates a little bit day to day and case to case.
Okay. Well, it was a pleasure meeting you. Thank you so much.
Thank you very much.
All right. Can I have a business card?
Sure.
Thank you very much for taking the time.
Hi, Melanie. I'm Catherine Tracy.
Hi, Catherine.
PTGPT. How are you doing today?
I'm doing good. How are you?
I'm good. I'm good.
Right.
Yeah, thank you for meeting with me today.
All right, no problems. Great pleasure to meet you.
You too.
All right, so first off, tell me a little bit about yourself.
Yeah. So ever since I was little, I've just really enjoyed helping people, anyone. I would go over and help my elderly neighbors and do anything I needed to do with them and just be a companion or help take in the wood and help them with their puppy. And I'd also babysit a lot, so I have a lot of experience working with children and adults, just people of all ages. Part of me giving back, I have been a part of a few organizations. In high school, I started a club called Educate, and it works through the organization called Educate, and they help sponsor students in Africa pay for their education and schooling, and they really emphasize the students giving back to their communities as well. And I really like that idea because it's paying it forward. I also was a part of a research opportunity at my school with one of my professors. I had worked with a patient who was status post ACL reconstruction, and we worked with her in the pool, so it was part of the aquatic therapy program. And that was a great experience, and that was the first patient I really had a chance to work with, and it was really nice seeing her achievements and being able to help her. It really made me realize why I chose physical therapy.
Wow, that sounds pretty amazing. It's a great opportunity. All right, so tell me, what are some of your strengths and weaknesses?
Okay, I'm going to start with weaknesses. I would say that since I am a recent graduate of Ithaca College's DPT program, that I have not had as much experience as a therapist who's been out in the field for a while, especially in neurological diagnosis. I feel like there's such a broad spectrum of cases, and I think that not having had too much experience in that field has definitely limited me, and so I have not seen all the patients that fit under the neuro side of physical therapy. For documentation, I definitely feel like I'm not as efficient as I would like to be, and that is something I would like to work on. For strengths, I really value developing a strong patient rapport. I feel like having a therapist and patient relationship based off of trust and respect is very important in their outcomes and prognosis and just the whole treatment session and timeline in general. I also feel like I do a really good job working well with others, and I kind of feel like sometimes I take on the leadership role. I have helped organize the LSVT Big certification program held at Ithaca College, and so doing that I've had to use my communication skills and working with other classmates in order to organize that.
Yeah. Those are all strengths and abilities that we look for in our physical therapists here. So why does this job interest you?
My first clinical affiliation was in an inpatient rehab facility, and I would say 50 to 75% of the patients that we saw had neurodiagnosis. And I learned very quickly that you can have two patients with the same diagnosis, for instance, let's say stroke, but they have very different impairments, and you have to plan very different treatment sessions, and their prognosis is very different. And I feel like one big achievement could also be a small achievement for another patient, and I feel like neurodiagnoses are kind of like a puzzle, and I really like having to solve that puzzle, and it just really drew me into this field of work. I also know a few people who have had strokes, and I feel like it just hits close to home, and it really makes me want to help and give back to people who have gone through certain things.
That's great to hear. Right. So, why are you interested in working at this organization?
Okay. The Kessler Institute, I know, is ranked really highly, and I feel like they have really highly or well-trained therapists and nurses and doctors, and I feel like you have such an advanced team. And I know in my career, one of my goals is to always strive to be the most excellent physical therapist I could be. I am very determined, and I always strive for that excellence. And I feel like that your institute has a lot to offer, and I would really like to learn from the other staff and faculty and therapists that you have on board. I also know that you guys put a lot of emphasis on research and funding into that, and finding new ways to help treat patients, and just always on the forefront of things. And in the future, research is something I'm very interested in pursuing, and I think it's really important to always find new ways and improve even more. I think there's always room for improvement, and so that's really, really interesting and nice to see that you're not only interested, but you also fund research opportunities. I know the Kessler Institute and Foundation has been around for 66 years, and so you've been in this field, you've seen it change so much, and I feel like you've had to be on the forefront of technology and treatments, and I just feel like the experience the Kessler Institute has in this field and industry also is very interesting and drawing to me to this organization, because I want to be with a company that really knows what they're doing and knows how best to help and treat their patients.
I'm glad to hear the interest you have in our institute. Okay. So, what past experiences have prepared you for this job?
So as I mentioned before, I have gone on 4 clinical experiences through Ithaca College. In my first one, we saw 50 to 75% neuro cases. I've also had an opportunity to work with a professor one-on-one individually with a few neuro patients in the clinic we have on campus. And that was really rewarding, because since it was one-on-one with the professor and then me with the patient, I got a lot of feedback and was able to really improve and develop my skills. I also am LSVT BIG certified, and I know that is very useful with a wide range of neurological diagnosis. And I also have some experience working in the aquatic therapy program, as I mentioned before, and I know aquatics can be very helpful with neurological cases.
Wow, that's very impressive.
Thank you.
So, where do you see yourself in 3 to 5 years?
In 3 to 5 years, I mentioned before I was really interested in research, and I'd like to emphasize that, because that is something I would like to hopefully be a part of, if not in 3 to 5 years, maybe further down the road. I would also like to continue my education and improve my ways and find new techniques to help patients and not just limit myself to the ones I've learned right now. So I would like to be either working towards or have finished either an NDT or an NCS certification at that time.
Yeah, research is something that we're very into, so it's good to hear interest in helping us expand research and learn new things. All right, so do you have any other questions for us about our institute?
I do, yes. I was wondering how many patients the therapist sees in a typical day, and perhaps how long. I know in my experiences through my clinical affiliations, certain inpatient facilities some would treat for shorter sessions, and I know some also treat for the 90 minutes because I know it depends on what insurance will allow, but I was wondering what like the typical caseload is for a day.
Yeah. At Kessler Institute, our physical therapists, they usually see on average 8 to 9 patients per day. However, this number does vary a lot, as you said, depending on the patient and how severe their case is. So on average, the patient we usually estimate an hour session per day, but however, if the case is more severe, it could take up to an hour and a half to 2 hours, but of course we compensate for that with fewer patient caseloads on those occasions.
Okay. Yeah. Thank you. I was also wondering, I know that you kind of divided up the certain diagnosis, and I didn't know if that meant that certain therapists would only treat patients who've had recent amputations or patients who are trying to recover from a stroke, or if they'd see like the whole spectrum of cases and they didn't just treat a specific diagnosis every day.
Yeah. Our physical therapists here, we usually have them being able to handle all variety of cases, whether it be amputees or patients with strokes.
Okay.
However, some physical therapists do have certain specializations that are more particular to, that are more like helpful for patients who had a stroke versus patients who are amputees, and in those cases we'll tend to give more of those like patients that are related to their specializations, but overall they're able to treat all sorts disorders.
Thank you. I think that's all I have for questions for now.
Right.
Do you have a business card that I could contact you if I have any more questions?
Yes, we do actually. Here's a business card here.
Thank you.
Yep.
It was really great meeting you, and I really do appreciate and thank you for the time you've taken out of your day to meet with me.
Thank you for your time. We'll be in contact shortly.
Thank you.
Hi, Kathy. My name's Casey Tarpey. Thanks for meeting with me today.
Oh, yes. Thanks for coming in. How are you doing today?
Good. How are you?
Good. So I just have a few questions I want to go through. I'd like to start. Can you tell me a little bit about yourself?
Yep. I am a recent graduate of Ithaca College, and I graduated with my DPT with a minor in coaching. And most of my experience has been in outpatient or subacute, so kind of covering the whole spectrum via my clinical affiliations through school.
Okay. Very good. Thank you. Can you tell me a couple of strengths and weaknesses you'd say you'd have?
Sure. So I'll start with weaknesses. I would say that because I'm a new grad, I don't have as much clinical experience as other clinicians who have been out of school for a while. I haven't really had that much time to be independent in the clinic because most of my experience has been on affiliations where I had a CI who was constantly checking in on me and making sure I was doing everything okay. So I would definitely say that that is a pretty big weakness I have right now. As far as strengths go, I was a coaching minor, so I learned in school how to motivate people, how to get people going, how to teach in different ways. And I'm LSVT certified, which can come in handy in an inpatient facility. And yeah.
Awesome. Thank you. What brings you, or why are you interested in this position here?
Well, I noticed in doing some research that you have both inpatient and outpatient settings, which will give me a little bit of fluidity, I hope, going in between the two settings. And I noticed as well that you work with LSVT, the program for patients with Parkinson's, and I think that that would be a good area where I could like get into the clinic, start off with something that I'm certified in, something that I'm comfortable doing, kind of grow my experience in that while transitioning into your clinic.
Awesome. Okay. Why are you interested in the Kessler Institute, this organization specifically?
Well, you're part of Select Medical, and my first clinical was actually at Select PT in a Connecticut location, and I kind of just like the feel of like an overall company where you kind of have a lot of resources, and you guys especially are very well established. You've been around for a long time, and you have a great track record. So I think that coming into a company like this will really be beneficial, especially as a new clinician with all the resources that you guys have.
Okay. What past experience do you have that what past experience have you had that prepares you for this job?
So like I said, I was a coaching minor, so that definitely helps in the clinic with teaching and motivating people. I was a Special Olympics swim coach in high school and actually at the beginning of college as well, where I worked with individuals from a young age to older individuals who had disabilities, developmental disabilities, physical disabilities, and I was able to successfully work with them, teach them, motivate them. And I also, like I said, LSVT certified. And just my clinicals have really prepared me, I think, to come out into the new job market.
Yeah, I think that's really great. Where do you see yourself in 3 to 5 years down the road? What do you hope to accomplish by then?
I hope by then to have found a concentration area more so where I can develop directly towards a certain population, have continuing education courses and really find a niche for myself to work within a clinic, which at your facility there's plenty to choose from, so hopefully that'll work out well.
Yeah, hopefully. Well, do you have any questions for me?
Yes, so like I said, you have an inpatient, outpatient facility. Do clinicians work in both? One, is it kind of as your patients progress through? How does that work?
Mm-hmm. So a lot of our our patients who've been in our inpatient care do tend to transition to outpatient if they're from a local area. It's difficult for the ones that do travel or who come across the world or country to continue in the outpatient care just for that reason. I say most of the therapists are either outpatient or inpatient, just so that way they can consistently see the same patients in that way, and they usually tend to prefer one or the other. Yeah.
Okay. And then, like I said, I want to kind of continue my education throughout as I start to get into the field. Do you guys have a lot of continuing education opportunities for your clinicians?
We do provide some funding for continuing education. We are very big in research and providing funding for that, and we are the top, and in order to keep the top clinicians, we want to make sure that they continue that education, so we definitely provide opportunities and funding for our staff.
All right. Thank you very much for meeting with me today. Do you have a business card?
I do, yes.
Thank you very much.
Yes, thank you.
Hi.
Hi.
Thanks for meeting with me.
No problem. How are you today?
Good, how are you?
I'm doing good. So why don't you tell me a little bit about yourself?
So my name is Mary Claire. I'm a recent grad of ICPT at Ithaca College, and I did get my doctorate there, so I am right out of school. I recently also got my certification in strength and conditioning through the NSCA, and I run marathons for charity, most of which are for pediatric populations.
Very nice. What do you think some of your strengths and weaknesses are?
So I'll start with my obvious weakness is that, I am a recent graduate, so I don't have that clinical experience in being my own clinician. I've worked under other clinicians for the past 4 clinicals and throughout my years at Ithaca. So that'll be a new experience for me, which I'm really excited about. But in the same way, I kind of also see that as a strength because it is, I'm coming out with my doctorate as opposed to, previous masters. So that's a competitive edge, I guess I kind of see that as. But I also have worked under, the past clinicals, I've worked under so many different clinical instructors. So I've really seen how they shape their practice and really their style of treating and evaluation and that kind of thing. So I've seen a bunch of different styles and trying to mold that into my own. So.
Very nice. So what specifically about this job interests you?
So what I noticed in my research and just in jobs in general, I really want to enjoy what I do, and that's the reason why I went into PT, because I really think I can make a difference and really want to impact, this pediatric population. And what I saw from my research, that your facility specifically, the kids aren't the only ones having fun. Your therapists are very interactive, and it's a very cooperative environment in terms of so many different kind of clinicians working together. And everyone really has a piece to, a role to play, and a piece in that therapy, cake. So it's just, it looks like a great place to be. It looks like a fun place to work.
Well, thank you. Why are you interested in our organization?
So another aspect was, I saw it would be fun being part of that team, but also the idea of just being, a part of that team, that teamwork approach. I really like that. In my past clinicals, I've worked with more complex patients. They have more complex issues in terms of, maybe they have a speech impairment, or they have a psychological component, or they have, a processing or cognitive component. And in my past clinicals, I've really been able to integrate a bunch of different aspects, with different professionals in speech and in occupational therapy and, a bunch of different fields. And I feel like you guys really tie that all together in how many clinicians you actually have and how they work together to really benefit the one, that one client or patient that you're really working with.
So it seems like you have a lot of experiences with pediatrics.
Yes.
So what other experiences have prepared you for this job?
Through my clinicals, I've really worked with primarily inpatient. I have had some outpatient experience, but I really love the inpatient because you get to see them every day. You get to work with them. And so I really capitalized on that experience and just making that patient rapport and just really connecting with that person. So that inpatient experience, I think, is probably my best asset.
Very nice. So where do you see yourself in 3 years, and where would you see yourself in 5?
So I guess I'm a big picture kind of person, and that's why I'm interviewing today. I think, I can see myself working at a facility like this in 3 to 5 years. I really can see myself expanding through, continuing education through. I actually want to pursue a specialization through the pediatric specialty. So that is my ultimate goal, to be certified in that, but also to just continue this work and really just be a member of that team.
Well, thank you very much. You did a great job.
Thanks.
It was great to meet you.
Take care.
Okay, now I have to figure out how to shut this off.
Sorry.
Do you have any questions for me?
Yes, I actually do. In terms of, the caseload, what is a typical day? How many patients do you see and that kind of thing?
Well, typically we see about 6 or 7 patients in a day. If we have an 8-hour day, sometimes if we go a little bit longer, you'll have a couple more. Most of our patients are somewhere in between a half hour and 30 minutes for each treatment.
Right. Great. That sounds good.
Okay.
And also, just in terms of, I through my research, I've seen that you guys really, try to graduate the patient through to the outpatient program eventually. Is it more, when that child or patient graduates, do the therapists go with them to that outpatient? Do they stay? I just wasn't sure about logistics-wise.
I guess it just depends on the patient.
Okay.
If a patient really has a connection with the therapist and they want to continue on with them, then we allow that to happen.
Mm-hmm.
Or if they want to try somebody new, not for any reason they didn't like the therapist, but just either somebody is better at a specialty or whatever. Yeah.
Got it. Thank you.
Hello.
Hi, nice to meet you.
Nice to meet you too. Thank you for having me.
Of course.
I just want to compliment you on how beautiful your facility is. I just walked past the clinic and it was amazing. So vibrant.
Thank you.
So vibrant.
Thank you. So we'll just jump right to it. Tell me a little bit about yourself.
So my name's Eliza Dewart. I'm a recent grad of Ithaca College. I just graduated with my doctorate of physical therapy. While at Ithaca, I minored in occupational sciences, so I had the opportunity to take classes with occupational therapy students, which I feel was really beneficial because I'm able to bring a little bit of OT into my own practice, which I think, especially for peds, is really important to bring it all together holistically. While I was at Ithaca, I ran with the women's track and field team for 4 years, and I had the opportunity to be a captain my last year. And I also had the opportunity to participate in the Ithaca College Leadership Academy for 3 years, which was just really beneficial for me as an athlete and as a student and a future clinician. So yeah, that's just a little bit about me.
Nice. So why this job? What interests you about this job?
Well, I've always really had a passion for working with kids. I've always, taught Sunday schools, taught swim lessons. So it was just always like an internal drive for me to teach kids and also for me to learn from kids because, they have something new and exciting going on every day and always an opportunity for me to learn. And I just, looking at your website, I just see so much potential for me to grow as a clinician and to help children and their families. And I noticed that you provided the opportunity to do in-home assessments to modify the homes, which I think is incredibly important because I'm a firm believer in the home should change for the child, not the child change for the home. And I also saw that you do assistive device fitting, which is also really important just to have that all in-house. And I know it makes it a lot easier for the parents in my experience just to have all of them feel better about it.
No, definitely.
And I also noticed you guys have a pool, which is incredible. I love Aqua PT. I think it's a great form of therapy.
That's great. Yeah, no, we're really excited about our pool too.
Yeah, it's amazing.
It gets a lot of use.
Yeah, definitely.
So why are you interested in our organization specifically?
Well, I'd actually like to start by telling a little bit of a personal story. My best friend died when I was in high school. He had a terminal illness that they could not diagnose. It was an unknown illness. And he actually spent majority of his life in a hospital, and he didn't have a very good family life at all, so his favorite place to be was actually in the hospital. He was actually there for so long that they made him the mayor of the hospital for the month, which was like the highlight of his life.
That's awesome.
But I feel that Mary Free Bed is that hospital for a lot of children. Just from what I've heard and what I've seen on your website and who I've spoken with, I think that it is an incredibly positive influence on a child's life, and I think that's exactly how it can be, or how it should be, because an illness, a sickness, an injury can be an incredibly negative event in a child and their family's life, and it should be a positive healing process.
Yeah, no, that's really awesome that you have that personal connection.
Yeah. It was honestly, I felt so compelled to interview for this job because it was, I was very drawn to it.
Good. Well, I'm glad you're here. So tell me about your experiences that have prepared you for this job.
My last clinical rotation was actually at an inpatient pediatric hospital, and I saw everything you can ever imagine for pediatrics, neurological diseases, developmental disabilities, orthopedic injuries, musculoskeletal, everything, broad spectrum of everything, which I noticed you guys also see here, so it gave me a lot of experience in that. And then my other 3 clinicals, I had exposure to pediatrics, but not specifically. So this last clinical was really what had me honed in on what I really want to do and that drive to work with children and help them.
Nice. Well, sounds like you're in the right place.
Yes.
All right, so last question. Where do you see yourself in 3 or 5 years?
Here. But I've always been a natural leader in my life, so I see myself, taking initiative and helping others and leading everyone in the right direction. And I would really like to pursue continuing education and become pediatric certified specialist just to, enhance my skill set and be able to, further educate my patients and expand my own knowledge.
Great. Oh, I forgot one. I'm sorry.
No, you're fine.
Tell me a little bit about your strengths and weaknesses.
So one of my weaknesses is obviously that I'm fresh out of college, but that can also be a strength as I am up to date with all the recent research, and I always will have something to bring to the table, as every therapist will, and it might just be something new and different as compared to everyone else. And another strength that I believe that I have is that I work very hard. And I was raised that way, and that will never change. Sometimes I work too hard and I get too attached to patients, which can also be a weakness. You know, I get too invested in my patients because I have a very big heart, as all physical therapists do. And another thing is that I communicate really well with patients. I just am able to easily relate and sometimes have those difficult conversations with them. Yeah, so that's it.
Oh, it was great meeting you.
Yes,
Do you have
you
any
too.
questions for me?
I do actually. So as far as the type of environment that I will be treating in, I saw the clinic and that was beautiful. Do you ever treat in rooms, in the patient's rooms?
Yeah, it really depends on, the specific impairment. If for a certain reason we cannot treat in the clinic, privacy reasons, that kind of thing. We really adapt it to the child, like you were saying before. We really adapt our physical therapy and occupational therapy. Basically, we really changed to accommodate the child.
Right,
so.
yeah. That's what I was wondering, because in my last clinical I had experiences where the child would not want to get out of bed.
Right.
So
That happens.
just bringing therapy to them. Yes.
Right.
Okay, great to know. And will I have the opportunity for continuing education?
Yes, we do have a certain amount of funds, just directly for continuing education.
Awesome.
So we will discuss that more, and absolutely. Yes.
Awesome. That's great to hear.
That's great.
All right, thank you very much.
Yeah, take care.
Hi, how are you?
Good, how are you?
Good.
I just wanted to say that I've heard such great things about your facility.
Oh, good.
All of my clients at the gym that I work with, they all love it here. They've been there for PT and they just love it.
Oh, great. That's great to hear. Thank you. So start out by telling me a little bit about yourself.
Well, my name is Sarah Belanca, and I am a recent graduate from the DPT program at Ithaca College, and I really love it here. My dad went here, so I've been here for a really long time, and it's just a great place to be.
Good.
I'm originally from Rochester, New York, and I became interested in PT after I had an injury in my shoulder when I was, I don't remember, in the teens, I think,
Okay.
because I played softball. Throughout college, I was always very active and involved on campus. I still continued playing softball, so I was very athletic, and I am a member of the ICPT Student Association as well. I was very involved in that.
Awesome.
I'm a certified ACSM personal trainer and also a body pump instructor, so if you ever need your body pumped, you just let me know.
Awesome.
So I have a lot of experience working with people of all different ages and all background. I worked with students, I worked with adults, faculty, staff, pretty much anybody on campus.
Great.
I love working with people and love working with patients as well. My last clinical rotation was in an outpatient orthopedic clinic, and I knew that I would, and I know now that I would love working in that kind of facility.
Awesome. So what interests you about this job?
I'm very passionate about fitness, sports, and exercising, and I've always felt that I fit in really well with this type of patient population. This is the setting I enjoy working in, and I can see myself excelling in a facility such as yours. My background as a personal trainer and group exercise instructor has prepared me for working with patients for longer periods of time, so I have learned how to create relationships with them. And I've also had prior experience with athletes and people of all different fitness levels as well.
Right, that's great. We have a huge facility that incorporates all of that.
It's beautiful. I've run past it many times. I always gaze in. It's wonderful.
That's awesome. And what interests you about Cayuga Medical Center?
Well, like I said, I've heard nothing but good things about Cayuga Medical Center, especially the physical therapy department. Mm-hmm. Everybody loves all the PTs there. I've had some of the physical therapists come to my school. I've heard them speak, and they're so bright, and they love what they're doing. I'm very interested in all the different specializations that you guys have as well. I think that that's amazing, and I think it's a wonderful thing to have at your facility. I do know that eventually I do want to specialize. I'm just not sure in what yet.
Okay.
But I'm willing to learn. I'm willing to have all the continuing education that I can get.
Yeah.
And it's also comforting to know that your employees have stayed with you for such a long time.
Yes,
and like I
have.
said, the facility is gorgeous.
Yes, it sure is. So tell me a little bit about your strengths and weaknesses.
I would have to say that my biggest strength is developing a good rapport with patients. I love building relationships with them and having them feel comfortable working with me. I want them to trust my knowledge and me as a therapist. I would have to say a weakness is obviously that I am a recent graduate, but I do, I have learned all of the new research. I'm all up to date on everything now. So that's just something that we have to work with for now, but hopefully with experience.
Yes, of course.
And I also know that time management, not with organization, but with patients. I like spending time with my patients and making sure that they get the full amount of care that they need. So I know that's just one thing that will come with time.
Yes, that'll definitely be something that will develop with experience. So where do you see yourself in 3 years and in 5 years?
In 3 years, I hope to have myself established as a trustworthy physical therapist and gain a following of patients and referring physicians to bring to your facility. I want to be seen as professional and knowledgeable. In 5 years, I hope to become specialized in an area, which I said I'm not sure what, but I'm willing to learn. And whatever I feel like is good for your company, whatever you guys feel like is good, I am willing to learn as much as I possibly can.
Those are definitely good goals. And I know you mentioned that you had experience in an outpatient orthopedic clinic, but what other experiences have prepared you for this job, or just expand more on your clinical rotation?
My first clinical and my last clinical affiliations have been in outpatient orthopedic clinics, and they were in two very different areas. I was in one area that was a little more rural, so everybody knew each other. Another one was in a little bit of a bigger area, so not everybody knew each other, but there was definitely a different patient population. And I was also able to study under many physical therapists who had different specialties. They enjoyed different things, and they also treated a little bit differently. I was able to spend a few days doing some aquatic therapy in the clinics, which I really enjoy, and I also took a Grand Rounds course when I was in college as well on aquatic therapy. Through college, I took clinical Grand Rounds in the clinic at school, so I was able to get a lot of experience there as well. And also, as I said previously, I have been certified as a personal trainer since I was a sophomore in college, and I've learned to work with people of all ages, backgrounds, fitness levels.
Right, definitely. Do you have any questions for me?
Actually, I do. What's the typical work day like? How many patients do you guys see a day?
So it's an 8-hour workday, so you'll usually see about 7 to 10 patients. We do have the opportunity for you to be co-treating 2 patients at one time, but that's obviously, you will have input into your schedule starting out, and then we'll go from there, but that'll all just be based on where we go from here.
Okay. And how long about will I have for an initial evaluation, do you think?
So we like to do initial evaluations with a little bit of a treatment. So you usually have about an hour, and then you'll have to obviously do any documentation that you don't finish in that hour. You'll just finish during lunch or after work or whatever is up to you. But we usually allot an hour so that you can get through your evaluation and then provide the patient with a little bit of pain relief and just some gentle treatment.
Okay, well, thank you very much.
You're welcome. Very nice to meet you.
Very nice to meet you, too.
Hi, Ms. Blanca. I'm Nikki Standera. Nice to meet you.
Very nice to meet you. Thank you for coming in today.
Thank you for having me today. I really appreciate it.
Tell me a little bit about yourself.
I am a recent college grad from Ithaca College with a doctorate of physical therapy, and I also, while I was there, minored in business administration. And I just want to say, when looking at your website, I really liked how you had all these different mission statements for each unit, because each of those populations does deserve different types of care, and that really stuck with me, and I really liked what you had to say about the pediatric unit and trying to get them on the road to recovery.
Thank you.
I have experience in both outpatient and inpatient physical therapies through my clinical affiliations, and I was lucky to be exposed to vestibular PT, which I thought was really cool because it was something new to me, and I really like learning about new things, especially when people don't really associate that with PT, so that was a neat experience for me. At Ithaca College, I was a 4-year member of the women's Ithaca lacrosse team, and in my final year, I got the opportunity to be captain, and with that, I was on this leadership academy where I got together with one of the sports psychology professors at Ithaca College, and as a group of captains with all the teams, we got to have open discussions, and I really think it enhanced my leadership skills, and I learned to grow from that.
Very nice. Right. What interests you about this job?
When I was growing up, I had a injury myself, and I got the experience of PT, and I immediately clicked with it, and that interested me to start with. And I've also always loved working with children. I was a nanny for several years, and just to be a part of the PT and the child experience to really make those kids feel special interests me. And as of my last year on the lacrosse team, we worked with a child being her sponsor down in Florida who had cancer. And that emotional connection we got, even being states away, was an incredible feeling to make her feel like she was invincible and a part of the team when she was going through all this treatment for cancer, that she had us. And that's kind of what I want to be as a physical therapist, that they come and see me, and they have me, and they have our team as a facility. So that really stuck home with me. So
Very nice. Tell me a little bit about your strengths and weaknesses.
one of my strengths is time management, especially coming from the demanding major of physical therapy and being on a D3 athletic team. I really had to balance everything to make sure everything's done in time. So I take that into the clinic with me. I spend time and form my relationships with my patients, but their time is very valuable too. So I try to keep everything on time because every patient is just to spend that 1 hour with every patient is really important to me, or however long I spend with them. And one of my weaknesses is that I tend to be a perfectionist, so I want everything to be perfect and done like this, but I'm really working to being open about going with the flow and taking new tips, and because that's what's going to incorporate into the child's therapy to be better, to if this didn't work out exactly, but he's still getting better, or the patient's still getting better and doing what I want it to do, then that's all that matters.
Very nice. Do you have any experience that have prepared you for this job?
Yeah, I've had 4 clinical affiliations, and on one of them I was in a home or school care program for pediatrics. I would go into the schools, and I got to see a lot of different developmental conditions, and really exposed to a lot and help them incorporate into their daily lives physical therapy. So that was really awesome for me. And for 3 years I was a nanny, and it just really helped me learn interactions with kids and how to get them to do something that doesn't sound fun, but to make it fun and make it a great experience for them, because that's what matters.
Yeah. Where do you see yourself in 3 years and in 5 years?
In 3 years, getting familiar with this facility, I really looked like I would fit in here and a great spot for me. So in 3 years, I'd really like to be a trusted and established physical therapist here that's being able to carry their own caseload. And in 5 years, maybe stepping into a leadership role, whether it's just taking on extra responsibilities around the facility or helping running annual events, being on some type of small committee. I'd really like to bring my leadership experiences that I learned throughout college and at my clinical affiliations here. Also, I'm very passionate about learning, so getting chances to do continuing ed and being a pediatric certified specialist would be a great interest to me.
Very nice. Are you interested in our organization?
I've heard great things about Mary Free Bed from across the nation, and being on your website, just seeing, I just had a connection even with your website that it felt like a great place to be, and I love the emphasis on involvement of family, because that's very important, especially in pediatrics, and I think in general anyways, because everyone is going through therapy that needs support outside. So I really like the idea of having family involvement. And I think it's really cool your graduated program where the kids are an inpatient, but they also have the outpatient facility. So once we get them graduated, it's familiar to them. I can still keep in touch with them, which really would be awesome to see them grow even more after their inpatient experience. And that you guys look like you want to have fun for the children and for us. And I don't want therapy for the kids to be a chore. Like, it should be something fun, and I want the therapy team to be like the bright part of their day. So that really meant a lot seeing that.
Mm-hmm.
Well, thank you. Do you have any questions for us?
Yeah, I was wondering what your continuing ed program looked like, because I know I would like to continue about my pediatric learning and everything. So,
Well, we usually give all of our therapists the opportunity to continue on with their education. It just depends on what they want to do, what we can afford, what we think is best for the clinic. So if you're open to options, then that is definitely something that we can provide for you.
okay, great. And what would a typical caseload look like, a typical day?
Well, if you're working an 8-hour day, I would say probably somewhere between 6 or 7 patients. We usually give the patient a half an hour to an hour, depending on what kind of conditions they have. If you're working a longer day, you might have a couple extra, but
Okay.
Yeah.
Oh, that's great to hear. All right, thank you so much for meeting with me.
thank you so much.